as well as multiple antimicrobial stewardship committees and the National Technical Working Group on AMS. Lois leads work in AMR surveillance. A round of applause. And finally, we have Dr. Chris Baraza, who's the General Secretary and CEO of the Christian Health Association of Kenya. He's the General Secretary, and he is a governance and health systems expert with extensive leadership in NGO and program management, including senior roles at Aphrc Health East Africa, where he serves as the Chief of Party, and he leads strategic partnerships, advocacy, and coordination of faith-based health providers across Kenya. A round of applause for the gentleman. All right, so what we're doing is, in this panel, is translating scientific evidence into policy. Maybe we can start off with remarks from the panel. Greet us, tell us a little bit about what you think about this Congress, and then we can get into the questions. Over to you. The mics are on.
Hello, everybody. Yeah, it's a joy to be here, and I'm happy to be at this Congress. I think it's long overdue. I'm actually a little bit envious. I wish we had thought of this at our university, because this is a conversation that really needs to happen so that the gaps can be closed between research and implementation. So I'm happy to be here. Thank you.
Thank you.
Good morning, everyone. Very good to be here. Many thanks for the invitation. And I think, as my colleague says, critical discussions. Over the last few years, we've had opportunity to work with policymakers, to engage the media in terms of just getting to understand what are we doing and why should it matter to people. So I think this is a really timely conversation.
Thank you. To the gent in the panel, we have not observed.
Yeah. I'm lucky.
Yes.
Yeah, but Dr. Moth knows that I'm a gynecologist, so I'm not in a strange space. I'm at home. Yeah, so thanks so much, and thanks for the invitation. When Richard called me a few days ago and invited me for this meeting, we had a lengthy discussion, and it resonated well with what I've been thinking about in terms of to what extent is what we are doing, especially from the FBO space, being seen out here. So I'm very happy and glad to be part of this discussion in terms of how does the media, or how do we project what we are doing from a program perspective, from patient perspective, how does that translate into visibility? And I'm glad to be part of this conversation. I'm looking forward to it.
Thank you.
I think for me, this could not have come at a better time. We are living at a time when misinformation and disinformation is becoming a threat to us. And for science and journalism to be in one room, to have these vital discussions, it is the best time. And I think from here we will make more collaborations with the scientists who fear that we are going to misquote them. I think this is the forum where we network and make sure that you don't feel threatened by what we do, and also to hear your fears really beyond, you feeling overly exposed, or that we misquote or do not portray or relay the information as you relayed it to us. I think this is the best forum, and I'm grateful for the invite.
Fantastic. Maybe those who I had not introduced myself to you earlier. My name is Susan Kimasha. Now, I am a former medic. Fun fact. I did 3 years. Yeah. It's possible. And I think you're right, Anne. One of the hardest things is to be able to translate scientific data and information into pockets that are palatable and understandable by audiences. So I'll begin with Dr. Dorothy from the USIU, and my question to you is, in your view, how can universities ensure that research produced by scholars genuinely addresses world challenges?
Thank you, Susan. I think that is one of the issues that we are actually grappling with, because at the universities we face certain constraints. Of course, we all are encouraged to engage in research, but in actual fact, research is a very expensive endeavor, and therefore what eventually ends up happening, you look for funding from somewhere, and many of the times we know that they fund a research agenda, which may not necessarily resonate with the problems, social problems that you may be trying to solve within your community. But nevertheless, I think universities need to about their research agenda to ensure that it actually makes a difference and actually addresses pressing global problems. So I think instead of being very laid back and just responding to funding calls, it's good to have your own standpoint, to have your own research agenda, and now engage others from that particular platform, because our research agenda to the SDGs, and to see how we can contribute, and to also look for funding in that direction, so that what we are doing actually makes a difference and actually matters to the community.
Dr. Earlier we had a presentation by Mamadou, and he
able to do good work and translate your work into bite-sized information that is accessible to the masses. We have the platforms and we have the expertise. We can package your stories on Instagram, on TikTok, that I don't like very much, but now I am forced to be there, on Facebook, and make it relatable and accessible. I know we need to work on the relationships, and we can, and we should.
Okay. Yes, we'll have a session later. I know scientists are hesitant about social media. Unfortunately, we cannot avoid it. It is here with us. So you may not do the twerk videos and things like that, but you can give valuable information on TikTok that can actually help patients and help the world in general. Now, I want to be fair and have the gentleman speak, because I've had two ladies, actually three if you count myself. So in this in the essence of fairness. You have led large-scale research, Dr. and some of your programs inform service delivery. However, you have a niche, which is the faith-based organizations. How do you then feed that into the national conversation?
Thanks so much for that. So allow me to just probably paint a picture of who we are, because most of the times people don't understand actually who we are. So the Christian Health Association of Kenya is an association with a membership, and we have over 600 health facilities equivalent of CHAC. So together we have a platform we call the Kenya Faith-Based Health Services Consortium. And it's important to note that the consortium of faith-based organizations in this country provide about 40% of healthcare services to this country. So 40% of Kenyans actually receive services from these faith-based organizations. And if I was to ask here, probably a number of you have gotten services from some of our services, reliably so. So that provides a very good platform for us to be able to undertake translational science. And we are doing this from three perspectives. One, at the national level, we do a lot of advocacy. I'm sure most journalists come across CHAC when you're advocating for SHA payments. Yeah. I'm sure that's when you usually see us, when you've gone to the State House to meet the president, or you've gone to Dr. Moti's office and the CS to advocate for SHA payments. But there's a lot more that we do in relation to advocacy and just being able to push the agenda of research and implementation science. one of the projects that we are overseeing as CHAC is how do we sustain the HIV funding platform beyond March 2026? It's a discussion we're already having. And how do you use the faith-based platform to be able to continue providing services, for instance? It's an important discussion that we must have as a country. So we're advocating that, not just in Kenya, but even globally. But the question we are being asked is, where is the evidence to show that actually when you work through the faith-based mechanism, you are more cost efficient, you provide more accessible services, and you are also able to provide quality services for that matter. And that calls for research, that calls for more data, that calls for more information that will be able to inform even the donor to be able to give us more funding. So we advocate using actually data to be able to get more of that. The second level is at the level of the health facilities. And you'll be surprised as we speak now that Tenwek Mission Hospital is actually providing about 50% of all the cardiothoracic surgeries in this country. Yeah, and that's huge. It's a facility that has very high level of surgery in this country. But I'm yet to see any of you journalists coming there to profile what you are doing as Tenwek. So I want to invite you, come there and see.
Thank you for the invite.
The
We will
surgeries
take it. Certainly Anne will be there and Go, and we'll make sure our teams are there as well.
Yeah, and many more other facilities that are actually doing very good things in this country. But we need to really go out of our way and be able to profile that. The third level is at the community level, and we are asking ourselves this question. Is the population around Tenwek getting better in terms of health outcomes compared to the population that does not have a facility like Tenwek? And that's a research question. And I'm asking my team, does it matter that we have our facilities around where you stay compared to other places where we don't have such a facility? Therefore, it provides a platform for us to think through how do we approach from a population-based perspective some of the researches that we may want to do to be able to inform even future programming in relation to what you are doing. Thank you.
Fantastic. Dr. Lois, scientists attack research with a lot of vigor. But then that should be translated also with the urgency of getting that evidence into the hands of policymakers, because then it would not be able to bear the fruit it needs to do. So how do you think they can make that process seamless and more efficient?
All right, thanks for that question. And maybe I'll give an example of the experience we've had with our research work and with working with policymakers. So I co-direct the Center for Epidemiological Modeling and Analysis, mouthful. We call it SEMA in short, at the University of Nairobi. And we set up SEMA at a sort of critical time. This was just when COVID-19 was coming into the country. And it was a time when there was a lot of fear, a lot of misinformation, and a lot of panic around. And the question then was, how do we help provide government with answers to some of the questions that they need in order to determine what measures they need to implement or not? But we also realized that there are many other people also trying to provide these answers. I think someone earlier talked about, was it helicopter researchers? We called it parachute modelers, the way. And at the time, about how do we best have something that is Kenyan, that has the trust and the collaboration with government and with people that would enable the work that we do reach the policymaker quickly. And that is sort of what we started working on. And the main thing was not just coming up with something and taking it to a policymaker. It was around, what can you provide? And do policymakers have questions that they can pose to you? Because the best answer you can give a policymaker is to a question they have been asking, not a question you picked from somewhere, have answered it, and you want to push it to them. When they ask the questions, then the answers meet something that they need, and they're more likely to act on it. And setting up the center is a place where the DG's office, for example, could call and say, I need you to work on this, or I need an answer to this. Can you provide answers to this? Was very useful, because then you're aligned with what should be done for government and for the policymaker. So that, I think, is an important bit that many of us as scientists and researchers miss. I work at the university, we do a lot of research. A lot of it may be student-driven, researcher-driven. A lot of it is questions that you come up with, but you don't know how it fits into the bigger picture. When you work with the policymakers, you understand different aspects of the questions that you answer. It's not just that I provided this deep scientific explanation, but understand what the cost is. Understand what the impact of this to service delivery is. Understand what this means for patient outcomes. So I think for researchers and scientists, it's really working with policymakers. If our research is not impacting policy, then it really is useless. So working closer. And for, I'll give my example because we do a lot of clinical research. One of the things is at the Ministry of Health, Dr. Amoth, correct me if I misrepresent, at the Ministry of Health, there are very many technical working groups, there are very many technical departments. And I think the best thing is to engage with these technical departments, because then you begin to understand what pain points they have, what questions they have, and how you can best partner with them to answer those questions. And that's something that we constantly try to do, working with all these technical working groups so that we can support them well. The other thing is, when you work with the technical working groups and when you work with hospitals, because I'm a health researcher, a lot of my work is clinical work, is you understand the questions that patients have. Because at the end of the day, our work is to inform outcomes of people and of patients. So if you understand the questions that patients have, it means you are already partnering with people and where their problems are. So I think it really starts with partnership rather than with this great piece of evidence that I have. It's how does this great piece of evidence fit into people's lives, fit into government working? And I think that's really important in terms of having what we do translate into evidence.
Oh, thank you very much. I'd like Dr. Njoroge to weigh in on that, because my next question to you would be how this collaboration between scientists and communicators can improve the relevance and reach of that research.
Okay, thank you. Yeah, so the researchers and journalists, and can work collaboratively in many ways. First of all, there are many ways of communicating for researchers, and I think first with mainstream media. And in order to collaborate, I think it's very important to start to develop good relationships with the media, so that you're not just writing to them when you have an event, but you're actually including them in the work you do. You're trying to give opportunities to them, maybe if there's some relevant training, so that you can also build their skills, because really, the science journalists that we have in this country are few. So, and of course, science is changing a lot, so training is needed. And so to keep an ongoing relationship with the media, because the media provide credibility, the media provide access to communities, and even to politics.
If you were not vaccinated, we would be talking a totally different story. That's why, most, at least Kenyans, we have, that alama.
Like a mark.
Yes, that one. And I think that is where we come in as media houses and as scientists. By now, there should already have been a publication or a correction from a scientist, at least calling that out, because that going to the masses is really going to do such harm, because now it's already doing the rounds on WhatsApp. I think I've already gotten it. Tells you the forums that I'm in. Yeah, but yeah, and again, we need to redefine collaboration with scientists. For me, what would I have done? What should I have done by now? Because I've just been whining about it amongst journalists. I should have already scientists and said, can I come? Can I interview you? We need a correction. We need someone to counter this misinformation. Because with a reach of 1 million, a lot of media houses here Even I, on my platform at De Frontera, have not reached 1 million. 1 million people is a lot of people. And if that information gets translated, it just continues to spread. And so you have people who think you shouldn't vaccinate, you shouldn't get vaccinated, might catch harm to communities. And we need to be able to stand in the gap and do our job as journalists and as scientists. Call out this misinformation. And, you know, in redefining this, I don't know, maybe it will be born out of this, where scientists and journalists are in communication. We are talking about what you're doing as the science, even research that you're doing, but maybe you've already done it and it's in your shelves. Maybe that we can make use of that, or maybe it's something that you're working on. But I think we need to be on a platform that, you know, we are exchanging these ideas. And then we need to reclaim the digital space. How did it become the norm that now on that TikTok platform that I don't very much like, that the people who are holding space are people who've never been in a journalism school? And I can't hold it against them. It's a free world. I can do whatever I want to do with my information. But what holds us back from claiming the same positions, the same platforms, and conveying messages like, you know, what they're talking about? Dr. Moth normally has briefings. Why don't we have those platforms and take over those platforms so that people know? And as I said, audiences are intelligent. They will know where to go for information if you are doing this consistently, persistently, and using the experts that we have access to. Then I think we also need transparency and independence as journalists. It's not that the fact that we have this access that we won't question. We need to be able to critique and to question even the research that you do. We need to be able to ask the difficult questions and hold the space for the kind of questions that even the public would have asked you. So we need to be able to do that. And finally, for me, I see science journalism as nation building, right? That the scientific literacy, for me, is the foundation of informed citizenship. When people know that when I give birth, I need to be able to take my child for ABCD, you have done your part as a citizen of this country. So we need to be able to do our job diligently and converse more as a people. When we make science clear, contextual, and human, the public not only listen, they act.
Thank you, Anne. Now, clearly, the gap exists where the platforms are there. We're just not utilizing it optimally. That's what I'm hearing, right? So then the question would be, Dr. Baraza, what are the biggest gaps in translating now that health research into practical improvements in your sector?
Yeah, thanks. One of the considerations is a perception out here that research is expensive. Yeah, that by the time you get into research, of course there are some that are expensive, but I've always challenged my facilities in terms of how do we integrate at the design stage some of the potential outcomes that we foresee. And Dr. Moth, the question we're asking ourselves, for instance, now, in the education sector, which is a service delivery sector, we rank schools based on performance. In the health sector, have we ever imagined a situation where we rank hospitals based on performance? In terms of outcomes, yeah, do you have ever thought about a scenario where we say Kijabe has better orthopedic outcomes? If you do a hip replacement surgery at Kijabe, you'll get better outcomes compared to Tenwek. And there are indicators, parameters that you are assessing to be able to really say, if I go to Kijabe, I'll get better outcomes. I'm not going there because of cost only, but I'm going there because I know my outcomes will be better than when I go to another hospital. So how do we change that mindset so that people can start thinking about the end, even as they provide the services, and not just necessarily the cost for that matter? The second thing is in terms of what Anne has talked about. There's a lot of siloing, yeah, a lot of siloing. and lack of collaborative approach. So we do research, we publish, but then it ends up there that has been published. How do we translate that to break it down for the people in the hospitals to understand that whatever research has been done, it has implications, and we can be able to actually contextualize some of these findings them wherever we are. So we lack a scenario whereby someone can be able to convert that very groundbreaking research into palatable, stepwise approaches that can be able to improve on outcomes. So basically, we lack implementation science platforms that can be able to undertake some of this. The third one, and probably the last one, is just thinking through for the faith-based, from the faith-based sector. I think by the time we think about research, the resource basket that we have is so limited, you may not even think about research. You are still thinking, how do I pay my nurses? How do I pay my clinical officers? So we will rarely think about how do I now start conducting research. But the challenge we are giving them currently is not just to think about how do I pay my nurses at the end of the month, but ask ourselves, if I improve the quality of care for my patients, am I likely to get more patients, pay for the services at the facility, and therefore get more nurses or get more money? So how do we translate the outcomes to the balance sheet? Through research. You cannot do that if we don't have a research mind, for that matter. So we are giving ourselves those kind of challenges and be able to just see how do we approach it from probably an outcome harvesting model perspective. I'm a health systems person. So how do we incorporate some of these outcome harvesting models into our routine practice so that we can be able to follow through some of the things that we are doing?
Thank you, Dr. Now, penultimately, the final question to you, Dr. Lois Mbajo. How can then we effectively translate scientific evidence into policies and public understanding?
Thanks for that question. I think one of the times when we had the highest amount of public engagement with scientific evidence was during COVID. And I wonder, I don't know if people in the panel are allowed to ask the question, but I wonder why the media engaged with COVID so much. Is it because there was so much mortality? What is it that made that engagement so critical? Oh, you
want an answer?
Yes. Because, and the reason I ask that question is, that is a phase of life that of course was scary, and maybe that's the reason there was engagement. But there are other scary things beyond that. Why don't we have the same level of engagement?
My personal opinion is when I first announced COVID on air, it was a them problem. That was how we were reporting it. It was happening elsewhere. When we got patient to number 1, we were like, hey, it's come home. And so now we needed to understand so that we can convey information that would help us survive and avoid the kind of death and the situations that we were seeing internationally. So it came home. It was no longer a them problem. And then because it was a global problem, I think the saving grace was that the international community needed to engage with us because we all needed to save one another. Had it only occurred in Africa, I think the outcomes would have been different. But that's, yeah. Yeah.
All right. So I guess then you sort of answer that question of how do we get the problems that we have to speak to people? How do we get people to see a problem that's happening somewhere in Nyamira or in Turkana as their problem as well? Because as long as we see problems as belonging to other people, then we don't engage with them. And I think this is where the sort of relationship between the scientists and media comes in. And it's interesting, I get calls from media, and many times they ask me, so how many people have died? Because that's a language that is sensational, so to speak. If you're reporting how many people have died or something catastrophic, is get to the point of perhaps it's not just the deaths that should speak. It's about preventing getting to the point of death. It's about people walking out healthier rather than staying in hospital for forever. So I think it's about that engagement to understand, how is this my problem? How does this translate to the problem of your viewers? How does this translate to your problem? Because I imagine if you thought it could be your problem, you're more likely to act on it than if it was just other people's problem. And I think Anne probably said it earlier, that it should start before the results. What we like to do is whenever we have interesting results, we call the media and we have a media breakfast and we have a media briefing. But we're talking to them at the point of the result, which means someone is not invested in the process and what it means. So maybe one of the lessons I took was, can we work together from the beginning? Because then by the time the results are coming, we know what it means to people, and people are more likely to listen to it. So that's probably one thing that I would take. Let's work together from the beginning, not just coming to show results. And I think it's the same with policy. Just calling Dr. Amoth and saying, Dr. Amoth, we have some results, and they have no idea what we have been working on. So starting from the beginning, working together from the beginning, asking the questions together. And I believe some of the work that we do, if we're working with you, there are questions that you'd ask that you can incorporate in that research that you wouldn't be able to see just from a scientist's point of view. There's social, social problems that you bring up that we probably wouldn't have seen, where I was just thinking, I want to do a clinical trial. The costing questions that someone would ask right from the beginning. So I think more collaborative research from the beginning is easier to translate into policy, and is easier to break down for people's understanding. I think one of the other questions that often get asked, or for media, sometimes I feel like we have to look for what makes it sensational, so to speak. And I talked about the issue of how many people have died. It's a very common question that I get. But maybe finding what is this that makes something sensational. And if we incorporate and work together, even with communicators at the beginning, then it helps us to get to that angle that communicates our research a little better to people. And that helps with translating it to public knowledge. I think I'd spoken about the issues of policy and how best to translate our work into policy. And I think it's engaging policymakers again from the word go. And I'll give you one example. We do a lot of work in HIV research and HIV treatment. Many times when we have those results, it actually goes directly into the HIV guidelines. But the reason it goes into the guidelines is because we work with NASCOP in writing national guidelines, which means we know the questions that are bothering us about patient treatment, that by the time the answer is coming, everybody is waiting for that answer. So I think the issue of engagement from the beginning is really critical in how we translate the work that we do.
So your lens is that sensational. Our lens would be very different. But Anne wanted to weigh in on that.
Yeah, I wanted to just respond to you calling us on the day that you're launching a report. Yeah. As a TV journalist, that's a non-story. Like, I'll come and I'll be, because I know what the editor is going to ask me. What are the shows for this story? And they look at it and say, story number 7. Story number 7, when you hear story number 7 on TV, it is just before sports. So the likelihood that your story will be the one that dies is very high. Yeah. So for me, to have your story on air, you give me an embargoed story. You tell me, Mahathe, on such and such a day, we are releasing this. And this is what is happening. It's in Turkana, and we've finally found a cure for Kalazar. So, but here, this is where we were, this is where we went to, so I will go there before. Now you have prepped me. Yeah. And honestly, I think we are moving away from how many people have died. A story that tells the people of Turkana that there is a cure for Kalazar, it's a big story. It is a wow story. So, yes, let's collaborate, let's work together, because I think that's the future now. And we have such a huge opportunity in the fact that now audiences are fragmented, and like education, like food, health is a very, very good place for people to work together, because people will always be curious about health, because it is a lived experience. We are here because, we are healthy, or we are seeking responses to certain things, or, so there's a lot of curiosity, and audiences will always seek out that information. So yes, to collaboration.
Yes, sure, please.
So I think one of the other things that often journalists ask, and this is a question as well, is they ask you, because they want, yes, this is interesting, but we want to see someone who's been affected by this, And probably because we're not good storytellers and the patient is able to tell a story better. It's often a struggle. For me as a doctor, it's hard to say, oh, here is a patient, go, because that wouldn't be ethical. But how do you bridge that gap of not exposing a patient to necessarily be the one to tell the story, but still being able to tell a story that resonates with people?
All right, we had received a prior question. Could we move the mic to Sam Dorr from the Health Business Magazine? Tracy, please hand over the mic to Sam. There he is. Is the mic on the table? Thank you.
Thank you, everyone. I'm Samuel Doe Ouma. I'm a health and science journalist, and I'm also the editor of Health Business Magazine. From the presentations above, I have some risk. We are in the borderline of sometimes being labeled as maybe sensationalizing maybe the content of the research. So as a journalist and someone who has been in the industry for so long, what role does these local languages play maybe in amplifying this research? And again, how can institutions, research institutions and universities support communication translation so that when maybe these local stations report about research, even the researchers themselves feel that whatever has been translated, there's no loss of meaning in translation? That is my first question. Because on using the new media and
Sam, could you let her respond to that?
no, I was just to amplify that.
Yes.
In my practice of journalist, I know I belong to some local vernacular WhatsApp group.
Right.
And that vernacular WhatsApp group was very useful. Lois has just mentioned COVID. When COVID was happened, there were things like face mask, there were things like sanitizers. So we had to translate sanitizers in my local language that was in Luo. We had to translate even the face mask in Luo. Yes. So what we used to do, we had a WhatsApp group, and that WhatsApp group, I think even Joe Agace there, very prominent and senior editors. Yeah. So we could pose a question there and ask them, now, how can we translate, for example, face mask
okay,
in the Luo?
In fact, just for curiosity, so what did you end up translating it to? What did you call face masks?
In Luo,
yes,
when it happened first, it was even called Apogrombe. So it was no. Sure. And then
which means what?
Scaring sheep. As in, that is a direct translation. And then, you see, maybe scientists like Lois,
yes,
who maybe understand Luo, would have
a different word.
No, even not a different word.
Yeah.
Maybe an issue with that.
Because now you're scaring sheep.
My friend.
All right, let's have Anne answer your question.
That is one. And also for Dr. there,
yes,
who has spoken on funding. So I want to find out if these researchers sometimes, when they're doing the project design, does they sometimes include communication and maybe just interacting with policymakers, budget in that research? Because most of the times, when we want, like even those engagement, the prior engagement, even working with the scientists on the way,
Yes.
they tell us that we don't have that funding,
Okay.
and the only thing that we can do is call you on the last day when we
Yeah.
are releasing the findings,
All right.
so that you get it.
All right, thank you, thank you. So other than scaring sheep, Anne, could you take the first question, and then we'll have Dr. Lois take on the second one.
Yeah, I think vernacular languages play a critical role in science journalism. And it's upon us to work with other institutions, knowledge bearers, to ask the questions. Even by the time we were coming up with Barakoa as the name for mask, we had to ask questions. And KU was very instrumental because they would help. And we would call, you just call an individual professor that you know who has been teaching certain languages. Part of it is us prodding, asking the questions, and yes, doing our role and ensuring that people understand without scaring them. Because the moment we take on the stage and scare people, then science ceases to be, we cease to be the connectors, because we want to be able to connect the science to the audiences. So we need to do our due diligence in asking the right questions in the right forums and just deliberate. Sometimes you can just explain. If I was doing the COVID story now and trying to translate what a mask is, it would be kidude kinachozuia mtu kupata virusi. I will just explain, and I'm sure people will understand until such a time when we get a proper name for it, and then it becomes documented. And we also need to start documenting these things so that in your newsroom, I hope by now you have a translation dictionary, you know, that you work with to say, this is the Ramogi dictionary, this is what we call such and such, and you know, and that is how you also document knowledge, so that the person who comes after you 10 years from now is not going to be asking the same question that you're asking now. That's my response.
And as we wind up, Dr. Lois, his second question. Yeah. All right.
Thank you for the question. Maybe before I respond to your question, I wanted to add something to the question you asked about why people are so interested in news information then. It's good to understand what drives journalism, and there is what is called the news value, things such as conflict. So if there is conflict, definitely they'll be interested. Or if the issues of impact. So if something is huge, then they are more likely to be interested. Issues of proximity. So if people are dying in Australia, not so interesting, but if it's happening in my country, in my neighborhood, so understanding how journalists think and unusualness. We talk about the man biting the dog rather than the dog biting the... So what you need to do as a scientist is to learn how to frame the information that it will actually fit in within the news values. So it is not a matter of exaggeration or sensationalism. It's a matter of how I frame this information. And I think at that time when we had the minister, Mutahi Kagwe, he had a way of communicating that was making people pay attention because of the kind of words he was choosing. And I think that's a case study to see how scientific information can be delivered and actually attract public attention. So a lot of creativity is needed, which links up with the question he was talking about, budgeting for communications. It's very important to do that because we are not naturally creative. We want to stand there and give speeches, but there are many other ways that can be communicated. One of the long-running programs, Vioja Makamani, has really educated people about issues to do with the law. So we can start thinking of such scenarios in order to be able to educate people. So I think it's, okay, for me, obviously, when I'm doing a project, I always, I do include communications because that's my field and advocacy as well. But I think this needs to be standard practice so that scientists can really be able to reach out to the audiences they need. Thank you.
Thank you very much, Dr. We've had a panel of Dr. Dorothy Njoroge, Dr. Chris Baraza, Ms. Anne Mawadhe, and Dr. Lois Ombajo. A round of applause for the panel. They will make their way out of stage. Thank you indeed for your contributions. We are moving to the next part of the program. Oh, yes, certainly.
Yeah, I'm supposed to talk in the next panel, but because of time, I will not be there. Now, Samuel has raised some issue, and the good Dr. Baraza has also raised an issue. Baraza is concerned with how then do we get funding for HIV. But for us as journalists, one of the things that is really disturbing us is how do we continue to tell the HIV story? And I think Samuel and you are meeting somewhere. We need to work together in the sense that that issue of funding is not just for the science, but also for the communication of science. And then number two, Samuel is really a worried man, just like many other journalists, that where will I get the right word to use? So in our institution, I work for the Media for Environment, Science, Health and Agriculture, MESHA, which is a science journalists association, born 20 years ago. We came up with vocabulary that would help in issues of health. And we did Kiswahili and English, and Dholuo and English. So journalists, you don't need to tire, you don't need to be frustrated. We are there for you, so please get in touch with us so that we can do that. Finally, I thank the scientists. I know Lois did a great job during COVID, but you are worried that why were we thinking about the deaths? Why were we thinking about the patients? Please help the patients prepare to speak to us, because any journalist would want to put a human face to what the others have said, to what the data talks about. Thank you very much.
Thank you very much. We would like you to exit the stage on that end so that you can pick a gift on your way down the podium. Now, up next, I want to invite Dr. Richard Ayar. He's a Kenyan public health expert, a medical doctor, and a former lecturer at the University of Nairobi School of Public Health. He will have the honors of introducing our chief guest. Thereafter, there will be an address by the chief guest, and then we'll move into panel 2. Thank you.
Good afternoon, everyone. Thank you for your patience. I think it's been a very interesting conversation. And just before I invite our chief guest, Dr. Mota, I had 3 stories for you, but I'm only going to tell you 2 of the stories, and then the other one you can ask me later about that particular story. So I'm quite sure that when you woke up this morning, you either thought about life that there's a situation, or you woke up with some problems. And when we were thinking about this Science Congress, I'm sure many of you are wondering about why the word Congress. One of them is that we're thinking about the future. And the way I think about a situation that you wake up and this is the way life is. So whatever is happening in the world, that's what it is. And then there are people who wake up and they have problems. And when you think about policymakers, their whole world is around problems. Every single thing is a problem to be solved. And then we have scientists on this other side who are probably each carrying one problem that they're trying to solve. And so for the hat that we're wearing as media, the issue here is that how do we bridge that gap between we have this situation, we think this situation can be improved, we need to communicate it, and the scientists on the one side doing the research are holding this single problem. So there's a story. It may or may not have happened the way I'm going to tell it, but something did happen. So some years back, I was in a village, small village, somewhere off Tabora in Tanzania, and I was hosting some people, and one of the people who were hosting, there was a question around malaria. And I was asked, you're the health systems advisor, how many bed nets do we need in sub-Saharan Africa? And I'm like, okay. And that's the point where you wish you had a malaria guy next to you. So I hesitated. I said, I think we need a few million. And the gentleman there then said, you know, we want to donate. So we want to give the organization 3 million bed nets. Okay, so accepted. So we flew back, and then now I had to go, and at some point I went to MOH, the malaria division office. So I'm sitting in the office waiting to see one of the people, and I see one of the officers there happens to be typing a draft malaria policy for Kenya. And it was a she, so she's busy typing. And the policy then was that bed nets were only taken up by pregnant women. So it was very, very, very narrow. So I'm sitting there and I say, change that word only to all. And so at some point she stood up to go, and I changed, typed in it, all, you know. And that was it. Somehow it wasn't picked up, and it became a thing, and the draft, nobody picked it up. So by the time it was the DMS and all were writing it, and then a couple of months later, our president was going for the UN General Assembly. And the focus that year was on health, towards whatever. So the ministries asked for, can you send to State House 4 slides for incorporation? They will pick one. A bit of a debate, and then that slide about that Kenya will now provide bed nets for all is what got picked up. And so the president goes to UN General Assembly. He says, we're the first African country to give bed nets for all. And based on that, other African countries picked up on that, and then it sort of just became a policy. So now when we're coming back to discuss amongst ourselves, we're like, that policy has worked. And I'm sure lots and lots of people worked on this whole malaria thing, trying to get this policy passed. And later on reflection, I'm thinking, surely this is not the way that policy should be done. You know, there must be a better way, and I'm supposed to be a policy person. I taught at the university and so on. So what we're trying to do as the STAR is we want a more deliberate effort in terms of how it is that we get this communicated across. We can't just rely on, by accident, you happen to know so-and-so, you happen to be in their office, or you happen to catch their ear, and that's when policy gets done. So it's about all the things that we've been saying. Now, the second story that I was going to tell you was well, I wouldn't say so many years ago, but many years ago, I used to teach, so I took medical students around to facilities, and one of the facilities we used to go to was Kiambu Hospital. And the medical superintendent at that time, now I'm doing the introduction, so you know, there's always that formal bit where you say he's the Director General and so on, but this is the other side of him, why I think it's important that we have Dr. Aphrc with us. And whenever I'd go and take my students, Dr. Moth would find time, invite me to his office, come with the students, and then invite his management team and say, here we have medical students who are coming in, they need to learn about the facility and what is going on in the place, and you'd sit a few minutes, advise, and so on. So I really like that about him, because some facilities we'd go to, you would go and you'd find there's nobody, and people are sort of surprised that, oh, you have come again, it's you, you're a student. That kind of thing, just not receptive. And I think when we're having this first Congress, and we want to build this up in 20 years in terms of how do we engage, it's really great that we have Dr. Aphrc, the Director General, the Ministry of Health with us. He's, like you know, we were sort of saying, all the health of this country. He's the technical expert, and therefore I think we're in the right place to listen to him to tell us a few words and officially open the STAR APHRC Science, National Science Translation Congress. So let's give him a clap as he comes up.
Thanks, Dr. Richard, for those words of encouragement. First, allow me to convey the apologies of the Cabinet Secretary for Health, Honorable Adam Dwelle, who ought to have officiated this function. But because of exigencies of work, he's been summoned elsewhere for another meeting. So I'm here to represent him and make a few remarks on his behalf. I will make the remarks, and after I'm done with the official speech, because as a bureaucrat, this is the way we do our things, I will be able to say one or two things. The director of Radio Africa Group, Dr. Richard Aya, friend Paul Ilado, our hosts are represented by Amadou, the esteemed panelists who are here before, distinguished panelists, Dr. Lois, Dr. Njoroge, Anne Mawade, and Dr. Baraza. Very interesting conversation indeed. Distinguished delegates, ladies and gentlemen, good afternoon. It is my great honor and pleasure to address you at this inaugural Science Research Translation Congress. I acknowledge our partners from academia, research institutions, the private sector, and development agencies whose support and collaboration continue to advance the frontiers of science and innovation in our country. I also commend the organizers for convening this forum to elevate the conversation on translating scientific evidence into practical solutions for national development. How I wish that you had invited the technical team from the Ministry of Health to be part of the audience so that they can also be able to share their experiences and also their frustrations of how to be able to translate science into policy to be able to impact population health. But because this is a beginning, I believe we'll have a second chance where we also have the technical officers from the ministry share with you their experiences in terms of how to move from research into policy. Across the world, science and research are recognized as the backbone of strong health systems and sustainable development. Yet, even as we generate groundbreaking research in our universities and institutions, a significant portion remains underutilized, not informing policy, not guiding programs, and not improving lives as it should. This Congress, therefore, is both timely and essential. It signals a new era of collaboration, and research is not only produced, but is also translated, applied, and measured by its impact on people's health and well-being. In the Ministry of Health, we view research and innovation as indispensable tools for achieving universal health coverage and other national health priorities, from disease surveillance to vaccine development or vaccine introduction to digital health and health financing models. Research provides the evidence we need to make informed decisions. And the panelists have actually discussed this in the panel discussion regarding the misinformation that we continue to deal with, the disinformation, and how to be able to deal with infodemic. Africa as a continent continues to record more than 100 public health emergencies every year. And all these emergencies happen at community level. So there must be some communication that we will need to convey to the community to bring the outbreak to an end. And therefore, that is the nexus between science or research and journalism. And how do we then package that information? I like the question Samuel Doe asked. How do we pack this information and make it palatable to the ordinary person in a language that he or she understands? I'm at loss when I go to Ramogi Radio to be able to discuss SHA or whatever it is. And 3/4 of the time, I'm basically speaking in English. And therefore, I don't know whether whatever I'm conveying is in sync with what my audience is listening to. That is something that we need to be able to work together as a multi-sectoral committee of stakeholders. How do we then distill this information so that it can be able to influence behavior of our people towards a direction that we want to take for their own health? We are committed to strengthening the research to policy pipeline, ensuring that health policies, guidelines, and interventions are grounded in locally generated evidence. The ministry, through the Directorate of Health Financing, Digital Health, Policy and Research, continues to promote a culture of evidence-informed policy making. And two, we continue to strengthen ethical and regulatory frameworks for research. Three, we continue to enhance collaboration between researchers, implementers, and policymakers. And finally, we continue to promote and support innovation ecosystems through partnerships with national and regional institutions such as KEMRI, Aphrc, Kenyatta National Hospital, amongst others. We are also advancing data-driven decision-making using real-time information to improve service delivery and outcomes. And Dr. Barasa asked a pertinent question regarding how do we rank, why don't we rank our facilities? Yes, that is in the pipeline. You know, we have the Quality Healthcare and Patient Safety Bill, which was approved by the cabinet, is now in second reading at the Senate. Once passed into law, we'll have a system of how we can be able to rank hospitals. Because especially in the public healthcare system, we have a problem that sometimes you claim to offer services that belong to a level that you actually don't have the requisite human resource, equipment, and all other infrastructure necessary. Through this, we believe then we'll be able to have a system of continuous quality improvement. It will not be used as a punitive exercise, but for us to be able to continuously improve so that Kenyans can be able to receive the highest quality of health standards as enshrined in our Constitution 2010. And as a ministry, we continue to base our decisions on data. And we cannot be able to do this alone because we may not be able to have that expertise at the ministry level. That is why we have continued this partnership with other institutions, including academic institutions like where Dr. Lois comes from. Very, very critical in terms of data analytics, and then based on that, we can be able to take a position as a policy direction. For example, in the next 1 month or under 1 month, we are moving from 2 doses of HPV vaccine to a single dose based on our own locally derived data. And that will be able to promote better coverage because we'll be able to reach more girls. And I want to report here that our HPV vaccination coverage has dramatically improved despite the disruption that was caused during the COVID-19 pandemic because we used the school-based approach. Our first antigen is at 60%, and our second dose, which was in a single digit, is now at 38%. We believe that if we go to the single antigen regimen, then we'll be able to cover more girls quickly and therefore make the dream of the global community and the country to make cervical cancer a thing of the past by 2030. We are also going to introduce a second dose of inactivated polio virus vaccine to be administered at 9 months. Again, as Anne said, we are going to have the naysayers, the vaccine hesitancy, and therefore what I've learned from our discussion here today is that we begin with you in terms of co-creating. So before calling you for the launch, we need to be you need to be part and parcel of that discussion, so that you can be able to. And you know, as scientists or as technical experts, we are usually not very good communicators because we communicate like we are talking to our colleagues. So we want to use your voice to be able to then pass this information so that it can be able to influence our behavior. I believe these two changes in our vaccine, our national vaccination immunization program then becomes a good entry point for us to continue this discussion so that you can become part and parcel of that team so that we can be able to ensure the protection of our future generation. We must address the persistent know-to-do gap, the disconnect between what we know from science and what we implement in practice. Again, I can also there give a very candid example following the discussions we had in Figo in Cape Town a few weeks ago. Mothers still continue to die in our health facilities, despite all the investments we have made. That notwithstanding, of course, we have made progress, but we could do better compared to our peers in the region. We lose on average 16 mothers every day due to pregnancy-related causes. And there's this new molecule that was studied by scientists, implemented elsewhere, and then approved by the global health body, the WHO. There's a medicine that you give to mothers after delivery. Previously, we have used oxytocin. Now there's something called heat-stable carbetocin. And despite the science being there, despite its approval by WHO, in sub-Saharan Africa, from Kenya, Uganda, Sierra Leone, those are the three countries that are represented in FIGO, it took a minimum of 2 years from that evidence generation to that product being registered by the regulatory body. How many mothers did we lose in that span of 2 years? And therefore, we are also saying, why don't we use technology? You may not like TikTok, but why don't you use artificial intelligence? One reason of that delay, the cause of that delay is because the dossiers, their scientific data for the quality, safety, and efficacy are these voluminous. And if you are to give it to a pharmacist to go through that document, it will take 8 to 12 months before they finish with one volume. But now we have artificial intelligence that can be able to quickly scan through that document in a matter of minutes, if not seconds, and tell you, you need to look at this, look at this, look at this. And therefore, how do we also use technology to be able to bridge that divide and bring interventions closer to our people? Translation research bridges this gap by ensuring that findings from laboratories and pilot studies are transformed into policies, technologies, and health interventions that make a real difference. It also ensures that innovation is contextualized, locally driven, and sustainable. No single institution can achieve this alone. The translation of research requires synergy between government, academia, industry, and communities. The Ministry of Health welcomes continued partnership with academia, research institutions, the private innovators, international development agencies, in co-creating solutions together that improve health outcomes. Let this Congress serve as a platform for cross-sectoral collaboration, where we work openly with the media, with the research institutions, co-create together, carry one uniform message forward so that we can be able to impact population health. To quote again what Anne said, we are allies and not enemies in this. All of us mean well for our people, and therefore we need this close partnership and uniformity in our communication to the population. Health is very close to people's hearts. And that is why in the bottom-up economic transformation agenda, there are 5 key pillars, but nobody talks of the other 4. Everybody is only talking about the health. What SHA is doing right, what SHA can do better. But there are other value adds in the bottom-up economic transformation agenda. But because health touches everybody, then we can be able to leverage this Congress as a starting point for us to be able to forge a partnership and closer collaboration so that we work together as allies and not enemies to be able to influence the behavior change of our people. This is more so very important at this particular time when the financing landscape is changing. Therefore, you want to stretch that single shilling to be able to offer more health than was before. A lot more of our implementation of our interventions will come from our own domestic resources. Because the donor landscape has changed, and it has changed for good. Americans talk of America first. FCDO of UK, they want to increase their budget for defense, and therefore we look at the national treasury to be able to utilize whatever is available from our own coffers now and for the foreseeable future to provide that help. Our young scientists and innovators represent the future of health research in this country. We must continue to support them through capacity building, mentorship, funding opportunities, and platforms such as this Congress, where they can showcase their work and engage openly with policymakers. The ministry is committed to creating an enabling environment that nurtures their creativity and drives homegrown solutions to our health challenges. As we deliberate, I urge us to keep one central question in mind: how can our research better serve our people? Let us move from data to decision, from evidence to action, and from innovation to better outcomes and impact. Together we can build a resilient health system that not only treats illness, but also promotes wellness, guided by science, powered by innovation, and grounded in solid evidence. In closing, I wish to reaffirm the ministry's unwavering commitment to advancing health research and ensuring that its outputs translate into policies and practices that improve lives. May this inaugural Congress mark the beginning of a sustained national dialogue on how science can drive health transformation in a low-middle-income country. I look forward to the insights, innovations, and collaborations and partnerships that will emerge from our discussions today. With those very many remarks, it's now my honor and pleasure to declare this inaugural Congress officially open. Thank you.
Thank you indeed, Dr. Patrick Amath. A round of applause. We're now getting ready to go into our second panel. I'd like to hand over to Mr. Lawton, who will be able to lead the second moderation. Thank you.
All right. Can I take fabulous? All right, so good afternoon, ladies and gentlemen. Nah, you can do better than that. It's been such an amazing and fruitful day. So wave at me. Ladies and gentlemen, good afternoon. How are we doing? Asante Sana, thank you so much, Dr. Amoth, for gracing us with your presence this amazing morning into the afternoon. Now, ladies and gentlemen, I want us to go to the penultimate panel discussion this amazing day. And I loved and I enjoyed the first one because it was more about the technical bit, you know, the experts, good English, talking very well. Shout outs to Susan for doing that. But right now, I'm going to bring the journalists up on stage. So ladies and gentlemen, please, with a rounding ovation, please allow me to welcome the country director, Zipline Kenya. Please put your hands together for Mr. Charles Karaoke as he joins me up. Please, a round of applause for him up until he gets up here. He has an amazing bio. I'll send it to all your WhatsApps. But listen, it's phenomenal. Thank you so much for all that you do. I'd like to welcome Professor Silas Oriaso, Head of Department of Journalism and Mass Communication, University of Nairobi. Makofi kwake tafadhali as he comes on up. Please put your hands together for him. Celebrate him up until Professor gets up on stage. Makofi kwake, Professor. Please, you can come around, Prof. I also want to welcome, yes, thank you so much for staying with us. Asante Sana. Please, Mr. Daniel Agan Media for Environment, Science, Health, and Agriculture, who is with us this afternoon. Please, a round of applause for him. He asked a question a little bit earlier, and he should be joining us right now. Please, a round of applause for him as he comes up. And finally, I'd like to welcome, representing Dr. Mercy Korir from Willow Health Media. Please, a round of applause for Joyce Mutheu as she joins up on stage. Makofi kwake tafadhali. Please put your hands together for this amazing, distinguished panel as we, please, karibu sana. Sir, thank you very much, Joyce. And as we officially get ready to start. Now, ladies and gentlemen, I know I am probably standing between you and the rest of the afternoon, so we'll try and keep this as very tight as possible so that we can definitely have not only a fruitful discussion, but also have an opportunity where we deliberate as we should. Now, my previous speakers, or the previous speakers, painted the picture for us, ladies and gentlemen. They spoke about a very sensitive time where we were as a nation during the COVID-19 pandemic. And it's just that Dr. Patrick Amoth has stepped out, but I think it was one of the times in the history of this nation where, urban legends, propagandas, everything under the sun that you can literally think about was discussed. And not only that, and we've just figured from what Dr. has just mentioned this amazing afternoon rather, he spoke about vaccine hesitancy. And then he also spoke about, how can our research serve our people? Now, ladies and gentlemen, this amazing afternoon rather, I want us to have a very candid discussion. And we're going to make it as fun, as interactive as possible. And we're going to break it down to content that is as palatable as possible. Because there's different kinds of people in this auditorium. There's, of course, doctors, people that are extremely learned, but of course there's also members of the Fourth Estate, not all have had the opportunity to be medical doctors or be in the field of health and science. So we want to break it down to them as brief as possible and as palatable as possible. Now, we're going to start it off very simply because the purpose of this particular discussion is simple. We need to understand how information moves from the lab or the field to the public. What can we do better? What should we do better? And I loved what our previous panelists mentioned. One of them said, they really barely understand TikTok, but every day when you go on TikTok, there's people that have millions of followers, and they are spewing nothing but vaccine hate. They're talking about don't do it, it's bad, don't even think about it. But scientists, like most of you, are just chilling and criticizing them from afar. What can we do different? And I'll start with Mr. Charles Kariuki from Zipline Kenya. Charles, it has been mentioned, researchers have to prioritize communication. But I think we need to get into a little bit of the tenets. And I'm going to give you a few minutes to do this. The question is, how can we encourage researchers and institutions to prioritize communication and outreach as part of their research work? And I want you to use Zipline as an example. How can we encourage institutions and researchers, to prioritize communication? What do you have to share about this?
Good afternoon, everyone. Allow me just to give a very short brief about Zipline, just for the benefit of those who may not know about Zipline. So Zipline is the largest autonomous logistics company on earth, and we aspire to make every human get served equally in terms of accessing logistics. We want every human to access what they need, when they need it, where they need it. So we've been in Kenya since 2023, and a major part of our service is in the healthcare space. We operate out in Kisumu. So one big challenge, of course, being at the forefront of innovation, is people seeing drones in the air.
Yeah.
And being an American company, there was a lot of stigmatization. Why are drones flying in the air? We had people saying in the villages that we're spying on women bathing. We had all sorts of stories. So to aid with that, we had to reach out to the communities directly, of course, do our own community engagement, but at the same time rope in other stakeholders who could be able to articulate and share exactly what we were doing and stood for, and also showcase the impact we make. So for instance, when we came into Kenya, we were able to leverage on research that was done by independent bodies. For instance, we have publication by Lancet that highlights that in Rwanda, for instance, we've been able to reduce postpartum mortality by over 50%, and also increase the likelihood of people getting vaccinated by over 40% in Ghana, done by the Gates Foundation. So we were able to leverage on such publications, also able to leverage on certain media pieces, well-curated media pieces, but at the same time also proactively going out to the communities and having them understand what Zipline is trying to do. At the end of the day, we're trying to serve everyone and not cause any harm. And the last thing I would like to mention, it's always a continuous process and not one-off, especially as we expand into new regions and areas.
Thank you very much. Please a round of applause for Mr. Charles Kariuki. Thank you so much for sharing. And of course, I'll piggyback on a lot that you've mentioned, but a little bit later. I'd like to welcome Mr. Nicholas Etiang, who's joining us on this. Okay, thank you so much, sir. Professor, you're a scholar, a communications scholar, and I'd like you to talk to some of our researchers and our doctors that are with us this amazing afternoon rather. What is the biggest reason the public often feels disconnected from science? Growing up, science used to be one of the most coveted. It was a reserve of the few. Now, with the advent of social media, modern day media, nobody gets more questions than scientists. And it's questions not objective, it's questions based on, unasema kweli kweli. From your perspective, why does the media feel disconnected from science?
Thank you so much. Good afternoon. You sound very dull. What's the problem?
It's the science.
It's almost lunch and also science. Now, thank you so much. I really feel privileged to be in this panel today. And I also want to appreciate the conveners for really doing what actually matters. Why I'm saying this is that we've reached a point in time where we cannot sit back and wait for things to happen the way they do. This always, what I wanted to start with is the fact that we can't say that we don't have information, we don't have knowledge. We do have, but then our greatest worry is, do we have this knowledge really getting to where it ought to do? That is a big question. And so the question that you have asked me is like, why don't we have things that are scientifically communicated being accepted by the populace? And it is kind of simple, and you almost insinuated it by saying that science used to be a discipline that people held up there, and only a very few people did it and actually practiced it. And I dare say that even to date, we still have people who are trained through the purist, scientists who are here, who are trained through the purist paradigm, who still believe that science is about top-down, it's about critical knowledge that does not have to reach the masses, only in tempered format. And I still believe that those people are still within our spaces. So that is one great thing. So if you look at what science does, which is the most important thing, is it does what is at the heart of humanity. And as such, there is supposed to be a lot of collaboration, a lot of consultation, a lot of doing things together, which I think, even when I sat here in the morning, I heard my colleagues talking about collaboration, partnerships, and I've heard about this a great deal of times in almost all congresses, almost all seminars. But the biggest elephant in the house is, how can we change the discourse? How do we change the narrative? So a great deal of the things that we talk about is just that bit of stigmatization of science, that science ought to remain in the lips of just a very few group of people. So then there is what we call, and I still dare say that there's still what we call the scientific monologue. Look at communicators. And I heard this from the morning panel. Do we have communicators rated the same way as scientists if they were to sit on the same table? There is still something that they normally do, which I think is the main elephant. Scientists and communicators still don't really sit on the same table as social equals. That's a big issue. So communicators have always been given a lip service, particularly when it comes to this. You will hear scientists will start the processes, go on with them, and then look to communicators to just as purveyors, people who just send messages that were predetermined. Sometimes they do this with very little training. Look at even the people who carry the message. How well have they understood that their work goes beyond just mere purveyors to people who are critically part of community, who are supposed to be there from the beginning, which I think is the main issues that we have. Communication has been known to be able to make it possible to break the big bonds, the attitudes, the beliefs, and all the things that make it quite difficult. So I think that is just a brief of what I can look at and say about why people still look at this thing and maybe don't act. Thank you.
Thank you very much, Professor. Mr. Daniel, Prof just mentioned that the scientists view us as not co-equals. I mean, we've been relegated to just carrying the news, reporting what they have been doing within their spaces. Now, and obviously, I'd like you to look at it from the lens of measure, like which you mentioned a little bit earlier. What lessons has measure, learned about turning complex research into stories? Because you do that extremely well. Piggybacking from what Professor just mentioned, because you are at the center of ensuring that some of these stories resonate with the audiences. So if you piggyback, or if you look at measure as an example, because I wanted us to use some of our organizations as examples, What lessons have you learned, especially dealing with these scientists in this auditorium, and of course, the thousands or the hundreds of thousands that are outside there?
Yeah, thank you very much. I just want to appreciate the organizers who came up with this thing. I think it must have really taken you a lot of thought, and of course a lot of mind went into this. It's important that we speak, but it's also important that we act. I think what the good doctor said is that collaboration is something that he hears every day, and he's just wondering why we still talk about it. Are we really practicing it? Now, the lessons that we've learned as measure is that people go to school from class 1 to form 4, if you are lucky enough. If you are luckier, you will go to the university. And this is a ritual that happens every day. This is a ritual that happens every year. We are not going to stop the school system because we have so many people who are learned. Somebody once said that education, if you stop education, then you also stop humankind from existing. And there are only two things that if you stop, then humankind stops existing. One is education, the other one is sex. Now,
I like how you casually mentioned it, but fair.
Now, what we've learned over time is that we need to place training in its immediate context in the life of a journalist. And that training cannot go on if we don't do it together with scientists. Earlier we were talking about COVID. It brought about various, what I would say, new jargons, and journalists had to learn that. So learning is continuous. And there are two things about that. One, the scientists also have to agree to learn the way journalists work. Two, the journalists, however experienced you are, even if you are as experienced as me, I have done 28 years of journalism, you still have to agree and accept to learn. Number two is that within that relationship, the scientists also have to look at journalists as those people who are out there, not to ruin their reputation, but people who genuinely are looking for information to report. Number three is that constant engagement, the so-called collaboration. We do it through what we call the science cafes. I know Sam has spoken in some of our science cafes. They bring people together and we discuss things at that same level. So the issue of respecting each other, especially scientists and journalists, really works. The other thing is that journalists must also learn to make good use of their time. Many times, for example, the PS has just spoken, the DG has just spoken here about many things, and I was taking notes. Some journalists will take that for granted. The journalist must take up their space and report, because for every story that is not reported, a life is lost. And for every story that is told, a life is saved. Let me stop there, because it's...
I mean, you would have gone on and on, because I mean, a lot of us who are, of course, taking a lot of notes. Thank you so much, Mr. Daniel, for sharing that. For every story that is reported, a life is saved. And for every story that is not reported, a life is lost. Thank you so much for that powerful statement. But of course, you said something that I think as a journalist has hit me very hard. You know, you mentioned, I mean, you alluded, of course, that as journalists, we need to do better in terms of our research. We need to do better in terms of, you know, taking, quote unquote, taking our work a tad more serious in terms of if we're working with scientists, or if we're to deliver the news as credible as it should be, there's levels of information that we need to know. And I'd like to bring in Joyce, who's standing in for Dr. Mercy Korir. We had a question about for her in terms of, I mean, her being a doctor and everything, but I'd like to know from your perspective, from Willow Health Media, you know, and you've interacted with a lot of doctors, a lot of scientists. What do you think motivates scientists? You know, I mean, is it curiosity? Is it policy? Is it impact? Is it public good? Or is it to make money? Because to the general public, again, people that are the major causes of vaccine hesitancy always go like, the only reason they want you to take that particular vaccine is because they want to make money. Nothing else. It has nothing, no, there's no premise of thought. It is just they want to make money. What do you think motivates these scientists?
Thank you, Lutan. First of all, thank you for having me on the panel. I'm very honored to be among these very distinguished peers of mine. Like you said, the question was for Dr. Mercy Korir in her experience first as a medical doctor, then a journalist, and then entrepreneur in the health sector. So I think it's not really one motivation that drives it. I think it's a combination of factors. And the first one, like you said, is curiosity. I know he mentioned two things which stop life. I'll just add the third one is curiosity. People like to say journalists work on a kimbelembele, but that kimbelembele is the curiosity now we're talking about. And I think it also applies to researchers, such that when you're starting to do a research, you're curious, like, what is this? Why does it work like this? What happens when I mix this with that? It's like when you buy a child a toy. So after the initial excitement, they start breaking it down. What happens when I remove this? What happens when I add that? Yeah, so there's the curiosity bit of it. And then it comes into policy impact. So in your level as a researcher, you start asking yourself questions. So I'm here, I'm hired by the government to do this research, but for what purpose? So it's not just to fill my KPIs and go home. It's how can the findings of this research then impact policy decisions? And then the ultimate goal is for public good. So I've done the research, we've seen how it can fit into policy, but then how then do we translate this to public good? So I think it can't be looked at as one lens. It's a combination of the three factors, such that then once you start the research, you're also able to look at the end of it and how it's going to impact the people.
Absolutely, and I love the fact that it ends with impacting of the people. Thank you so much, Mr. Nicholas Etiang, for joining us. He's a Policy Engagement Manager for APHRC's Health and Wellbeing Programs, an advocate of the High Court, and of course a member of the Law Society of Kenya. Thank you so much for being with us this afternoon. Now, I'll go straight to you. I mean, in your view, what makes messages to decision makers compelling, practical and persuasive enough to drive policy action or reforms? She's just mentioned about, causing reforms. What do you think, what makes messages to decision makers compelling, according to you?
Thank you very much. I think I'll reference what the previous panel spoke about, when they spoke about the human stories that we need to tell. Mostly our research is about statistics, numbers, without the element of the human angle to it. For me, in APHRC, I'm privileged to work with both quantitative and qualitative researchers. And really, I think for me, I have a leaning towards qualitative researchers because they bring about the stories of individuals and they add the story to the numbers. So when you communicate to policymakers and you want to message, I think it's important to bring the voice of communities. And I think I'll reference again practices that have been established here in APHRC, that every research is not just a report, it's a voice of some communities. And before we do the dissemination or engagement with policymakers, we actually gather more insights from communities. They validate those stories that this report is talking about them. So when we engage, we actually engage using the voices of these communities. And in our practice, again, we bring them into the room when we do the engagement. Even today here, perhaps when you have conversations in the future, somebody spoke about lived experiences. That's a very important aspect in talking to government and talking to policymakers. So without the lived experiences of communities, I've been in research that involves young people, particularly focusing on teen pregnancies in Malawi, Kenya, Burkina Faso. What made us make headway in those conversations, and I'm happy and proud of some movements we've made in policy work in Malawi, is really bringing those adolescents as well to the table to speak about their own lived experiences. The study was about lived experiences of pregnant and parenting adolescents, and having them being in the room and speaking about their own lived experiences really helped us to move the conversations. Thanks.
Absolutely. And I'll just come to you. I'll continue with you as I get to Mr. Charles Kariuki, so that he can also answer that. You've spoken about policies and them being the voices of communities. And obviously you've spoken about the gains that you've made in your particular field. But my biggest question would rather be, how do you ensure that this research, or rather this pieces of research, reach policymakers and the public more efficiently? Because somebody mentioned in the previous panel that, I mean, almost 40%, I think that's a number that they mentioned, if I'm correct, of some of the research actually ends up being wasted. Doesn't, sorry?
Yeah.
Over 80%. I beg your pardon for that. They mentioned over 80% just ends up being wasted. How do we ensure that the people that are supposed to benefit from these research papers actually eventually benefit from them? And how do we ensure that the public actually receive and find out about these research papers as well? So the both of you, maybe we'll start with you, sir, and then we'll go into Mr. Charles.
Yeah, your initial question had two elements to it. How do we find our research in policy, and then how do we find our research in communities? I'll start with the first arm on how our research gets into policy. And I think Dr. Moth spoke about a little bit of that. And I can't remember, it should have been Dr. Lois, who spoke about implementation research and how we package solutions. Most of our research focuses on highlighting the problem, and we get it wrong if we stop it at that. We need to highlight the solutions, and implementation research really tells us that we need to package solutions that have been tested that can then be translated into action. I think the parting shot of Dr. Mott was how do we make this research to inform decisions. And critically, it's really the solutions that we provide in our research. If we don't provide solutions, then we're just telling the problem. So let's stop leaving our research at the problem level. We move it to the solution level. And our way of engaging government and making sure that we bring the solution to the table, office here, your very good colleague here, Agina, we call him Ben Agina, the brand, is our spokesperson to government. And therefore, when there are conversations, he is there. He establishes those relationships, and we built a reputation as FHRC, and perhaps all researchers, that's what you should be aspiring to build a reputation where you are relied upon when conversations about policy are being discussed. And then on community, I referenced my earlier point, but again, we also have a very strong community engagement framework we've developed. We work through what we call community organized groups that represents various communities. It's a model that we still shaping. It's currently implemented under our food, nutrition and food systems work, perhaps also nuancing a lot of health issues across Kenya. We have very strong of those groups in Laikipia, Samburu, Turkana, here in Nairobi, so that the people we engage with and build capacity to really understand that research speaks about their needs, and therefore we build their voice to be able to speak themselves. We take this research back to those communities, and that the people speak for themselves in various forums. We therefore build them as a mass for advocacy on use of evidence.
Interesting. I mean, probably off the stage we'll talk about, I mean, I'd love to know, like, I'm from the Maasai community. How do you bring, because you mentioned Samburu, how do you take it to the people in Maralal? You know, a research paper that was done in this particular facility. Do you translate it into their local language? Do you break it down to them as, I mean, in the best way they can understand? I could see Mr. Daniel has...
To Etienne, I think that's very exciting what you actually do. And I hope that the tether there is the media, particularly the communities that you're talking about. They have got very strong community radios, and even bloggers sometimes, and guys who can really ensure that it is out there in the social media. One thing that I want to say is that somebody talked about somebody having 1 million followers. But can I also tell you that in my earlier life, about 5 years ago, I used to post a lot of things on my social media, and I would not get likes. But sometimes it goes zero. But out of that, I would get gigs, the so-called consultancies, every year of about 300,000, 500,000. Yet nobody actually, reacted to the things that I post there. So I also think that sometimes we look at social media and you think that when people have really commented a lot, likes and what have you, then you are making an impact. So even the social media, I think, would really also work even within those communities. I was shocked that our church leader, a lady that I think is maybe not very literate, is on Facebook. So when I asked her, what is it that you are doing on Facebook? And she told me I ask so many questions. So I think the power of the social media, even at that grassroots level, is not something that we can, just wish away. Thank you.
Thank you. We'll definitely blot that out for your church leader. They shouldn't know what you said about them, but thank you very much. Charles, what about you? I'd like to hear your thoughts.
Thanks. So when, in the case of Zipline, we really cannot operate in a silo. We need to traverse. They need to understand why. So we need to share the stories. We need to share the stories of impact we've had. So before starting out in Kenya, we had to share media pieces. We had to share published research articles to prove this. So every now and then we go to them. Look, we have a list of 100 public health facilities we want to onboard, and they will always ask us, from the last time we met maybe 6 months ago or a year ago, give us an update of the kind of impact you have had. How many vaccine doses have you been able to deliver? How many units of blood? So those are the kind of engagements that we have. And that's the first level. At the county level, is policy. Like I mentioned, we're at the front line of innovation. So there are new things we bring to them that are totally foreign, light years ahead, but through these discussions, we're able to propel them to sort of put together different policies that can enable our business have more and also pave way for other players in the space. So the second is at the county level. We engage greatly with the county health management teams, the CCM of health, the director of health. We really sit down with them to understand the problems that they have and keep working with them and sharing the impact that we have with them. Of course, at the national level, at the Ministry of Health, and like I mentioned earlier, the public. So at the public, we talk of community engagements and also leveraging on third parties like the community health workers. For instance, when we had the the national vaccine campaigns, we really do a lot to have the community health workers go out there during the outreaches so we can have a more positive outcome in terms of vaccination rates, which then translates to more deliveries that we do, and ensuring that the vaccines are in the best usable state, where cold chain integrity has been maintained end to end and reduce wastage in the process.
Interesting. One of the, just to what you've mentioned, one of the strategies you're using is locally recognizable faces, people that are within the community, so that definitely that enforces a lot of trust and faithfulness.
Yes, and that's across the strata, top to bottom. Yeah.
Well, now we say bottom up, but I totally
okay.
understand it.
Yes.
But thank you very much. Daniel, to you, you're passionate about stories, and you're passionate about, the place of journalists amongst researchers. If you were to look at and talk to some of these researchers, how would you, help them ensure that their stories are not only engaging, which is very important, but also that they also constantly remain faithful to the data, that they're reporting out there? What would you tell some of these researchers?
Thank you again. I think that as a scientist, you want to communicate some data. The question that you need to ask yourself, data for what? Data for who? and when do you give that data? We are getting into a period where videos are becoming very and that kind of stuff. How then do we ensure that we just don't give graphics for the sake of giving graphics? So the use of graphics is also key, but we must also be very careful as to what it is that we want to, communicate. Everyday analogies, examples that we give, we usually call it bringing the discussion from the third floor to the ground floor. So in terms of your data, if your data is on third floor, how then do you bring it down to the ground floor so that journalists can easily, relate to that data and their everyday life? Once in a while, or many of the times, whichever, scientists tend to be very busy for journalists. I mean, the journalist has just interviewed you. Are you there for them? Even as they try sometimes to understand the very difficult data that you've given them. So I also urge scientists to be there for journalists. The other thing is, I'm just from organizing the World Congress of Agricultural Journalists. We brought about 38 nationalities to this Congress. And when I invited some colleagues, some scientists, they asked me, are you inviting us so that we come and speak? I said, no, I'm inviting you to come and attend. They did not come. And so, in terms of interaction, the data that we give, the people that we work with, as scientists, we must also agree to calm down. One of the reasons, let me reveal here, that made me become a journalist is that I tried science and I found it difficult. By fourth year, I was done with science. So when I was walking out of KU, those many years ago, I said, no, I want to communicate science. Because the manner in which even scientists themselves also take themselves, it also puts off people to become, scientists and what have you. And so I think that the word working together, we must put some new meaning to it. We must work together, and we must not tire of working with each other. We appreciate scientists the way they are. They should also appreciate us the way we are. Some of us are scientists who just gave up on the way. And it is important that we work together and put new meaning and new action into the entire thing. Thank you.
Thank you very much, Mr. Daniel. I totally resonate with you. Most of us actually gave up on the science at one point or the other. Joyce, as we start rounding up, Mr. Daniel has mentioned about being a science communicator, which I believe you are. How do you ensure some of the findings from most of this research, clinical research papers or clinical research translate into better health outcomes and system change? What would you speak in the light of that?
Okay, so first to researchers, I would say that your key agenda is to move the research paper from communication to change. How do you want the findings of the research to influence change? So I'll use an example of a story we did early this year in March about gambling. So gambling, people look at gambling and say betting is not a health issue. But then we did a story where we looked at research papers that have been done on gambling, and we did a story titled Betting on Disaster, where we saw that first, betting is a social determinant of health. We went to the villages and we looked at these dads. So the dad gets a T bonus, and then he uses it to play that game you guys know. And then eventually when schools open, his kids can't go to school. His daughters can't buy pads for their menstrual care days. So it's a social determinant of health. Then there was also a study that was done by the National Library of Medicine about gambling and its linkage to suicide and suicidation. So they were saying there's this cohort of men between, I think it was 18 and 40 years old, and the rates of suicide are going high because of gambling. And they were connecting it to the English Premier League. I don't watch ball, so I can't speak much on that. But as you can see, it's a health issue. So as a researcher, when you're doing this research, what is the end goal of the research? So first you need to have the end in mind. So you're doing a research on the relationship between gambling and suicide, but what do you want it to do? So after we published this story in March, I remember other media houses picked it up. It became a whole issue. And sometime in April, the government, through the Betting Control and Licensing Board, they suspended gambling adverts for some time. And they banned the whole things on radio, Lipa 20 Bob and get this. So all those things were suspended. And then they created an agency, a multi-sectoral agency, to fast-track the gambling control bill, which has been in Parliament stuck since 2023. So you can see this research, it came and led to a policy change. Okay, of course, we still don't know the results of what the multi-sectoral agency has gotten, but we're hoping that they can be able to come with solutions, to this gambling problem, because it had really become a problem. So to researchers, one of the things is to work with the end in mind and then communicate the findings. So once you do the research, I'm sure you communicate among researchers and say, hey, this is what I found. But then what do you do with that information? Because then when you shelve it, it becomes the 80% that's wasted. So this is where you bring in media, talk to the media. Even if you don't bring faces, we can find the faces. Just say we did a study in maybe Turkana. The media knows how to go to Turkana and find those faces. And you'll find that people in these remote areas, they really like talking. They'll give you a story. Oh, this is what happened to me. And that's how we bring now a face to the research. And then after that, create feedback loops whereby we can go now back and say, this is what we communicated, this was the findings, and now this is the feedback we're getting. Is it working? Our recommendations working? How do we tweak the policy to work for Kenyans specifically? Yeah.
Interesting. Please a round of applause for Joyce. Thank you very much for sharing that. I mean, I could see most of the media owners in the room look at you differently, so you're the person that actually... Finally, you've mentioned, or rather, Professor, to you, I mean, there's the Daniels of this world, seasoned journalists. They've been in and around this space, and they know how to report. They are ready, when you send them wherever you want to send them. But of course, you're also working with the Gen Zs of this world, the future Daniels of this world. I think I'd love to know, how are you preparing them to be not only excellent communicators, but also how to simplify evidence without losing accuracy or depth? Because if social media is anything to go by, I was talking to somebody from TikTok, and they mentioned something that was quite interesting. They said the average Kenyan scrolls, because TikTok is all about scrolling, yeah? Because it's 30 seconds videos, 40 seconds, a minute maximum videos. They scroll the height of the Eiffel Tower in a day in terms of content. That is as much content as they consume a day. That means essentially what Daniel would have thrived in the past in terms of great feature stories, 20-minute pieces, has that been eroded? So how do you help your students? How do you prepare them to simplify? Because they're talking to a brand new generation, but also at the same time, in this simplicity, not lose, the data that, or accuracy of the data that needs to be communicated.
Thank you. Let me say that universities are subsets of society. Just like we have scientists, communicators, and policymakers who are also part and parcel of the society. It implies that society, when we are happy, they are also happy. If we are sad, they are also sad. So universities, colleges, training institutions are actually having information around what happens in their societies. And one great thing that I think we pay much attention to today, just like our previous panel had indicated, is actually a kind of paradigm of training and research that is very much sensitive and receptive to the state of affairs at the moment. Many things have changed. I wanted to say, before I go into the specific that you asked me, about probably how we have done things previously and why and what changed. So initially, the area of communication was you first of all went to a discipline to study, and I know many of us here studied other things before they came to communication, either probably at postgraduate level, and then maybe at master's level, and then maybe PhD level, or at even professional levels. So that kind of training was thought to be able to give people who will train, who will practice, some idea around the issues. Can you imagine, guys, if a journalist or if a communications person that has been trained has some broad knowledge in the almost every area or the critical areas of our community, what sort of reporting, what sort of communication will we have from such a person? We know that, we know even the architecture of practice of communications. We even have people who are not well trained. They have not joined any university or colleges to do what they are doing. But then they are handling critical matters of our time. Is it time that we re-entrench this kind of training where we give our people who we train some critical idea around generally all issues, most of the issues that we face as community, so that even as they interact with scientists, they don't go with bare hands. We've seen situations where people today, or many training institutions today, like sexing things up. I come from UON. You people know the UON. We still insist on kind of traditional curriculum, traditional syllabus that anticipates new things. So new things that come are normally automatically embedded through what we call course improvement, course content, course outlines, but not changing the things for the sake of pursuing market for the sake of it. So are we comfortable with training that is sexed up so that people can just come and study only what is going on at the moment? Or do we entrench critical issues of our moment? That's one issue that people need to ask yourself. The other issue that I also wanted to think about, universities are also researchers. Quite a great deal of data and literature that are supposed to be relied upon by policymakers, by people who implement, are actually coming from such environment. And I dare say that up until we got a new model of training, which is now what I want to just elucidate a little bit, we still had a lot of research that is kept in the shelves that were begun by issues that were not really issues of the community or societies. But what about if we were to do what we are doing, ensuring that researchers that come from the universities are those that will only address issues of importance to community? Can you imagine a case where science meets community or society, so that scientists and non-scientists, like even communicators, will sit on a table before they imagine even an issue to be researched? Why would you research it? Is it knowledge for knowledge's sake, or knowledge for action that we are talking about? So we are thinking about a more of a TDA, a transdisciplinarity approach, where much as we would think there is a differentiation, we still have the journalist knowing a little bit of what the scientist is talking about. Then we also envisage a model of study, a framework of study, where if you want to generate new knowledge and disseminate it, then you have to be, you start to develop it at the beginning, all of us, so that journalists and communicators are not called upon to just report things that they were not privy to initially. That, I think, helps sort out the jigsaw, the kind of issues that we have been talking about here. The other issue that I think I wanted to mention a little bit is that bit of even training of the scientists. How are our scientists being trained? Have you ever laid your hands in a curriculum that is used to train medics, for example? When medicine came, we actually had a traditional approach to medicine in Africa. But when we had the conventional one, through the Hippocratic germ theory, things changed. So we had to embrace another model that we call the biomedical approach. So this biomedical approach actually operated through the natural science principle and pervaded centuries until people thought like all these issues that we have in communities are not only tied to things that are amenable for experimentation, germ, and all that. In essence, medicine changed into psychosocial, biopsychosocial approach that we see even today. It means we are bringing other issues that were not initially within the scope of medicine to reflect what we have at the moment. Can we say, just as I end, that even as we have new media, AI coming, we need to be alive to such kind of things and put them in the curriculum and address our issues about this and encourage the people we are having today. When I look at many Gen Zs, and I'm afraid we have some of them here, I'm slightly above Gen Zs. When I have them and I look at them and think about what I really get worried that are they people who will really focus on the critical matters of our time, so that they are able to leverage on the emerging media, the new media, the social media that we have. Personally, I've done my bit. Actually, I'm lucky to be both a scientist and also a communications person. I, at the moment, having realized that many things need us to go directly, came up with the Professor Riaso Dongo's Knowledge Hub. If some of you meet such a thing, you will see the kind of approach we are having. Much as we would say that scientists will say that we don't want social media or we are not comfortable with social media because of this and disinformation. Now a professor like me will even reach out to you. Yeah. I will disseminate my ideas directly to you, hoping that as Jesus did, through broadcasting, we are able to reach out as many people as possible and bring them in a new paradigm. Thank you so much.
Thank you very much. Please a round of applause for Professor. Thank you very much. I mean, you've shared very deeply and passionately. Of course, most importantly, you've talked about it's an opportunity not only for us to train the future in terms of journalists to understand scientists, but we also need to train scientists to also understand journalists themselves. And of course, one of the biggest take-homes from this particular panel discussion, and this is definitely an ongoing conversation in the right direction. Ladies and gentlemen, one more time, please put your hands together for this amazing panel. Thank you very much, Mr. Tiang Asante Sana. Thank you very much, Mr. Charles Karaoke Asante. Thank you so much, Professor Silas. Thank you very much, Mr. Daniel Agan. And of course, thank you very much, Joyce Mutheo. Please put your hands together one more time for this amazing panel discussion. I'll ask our distinguished panel just to move into this particular direction. We have a special gift from Mr. Ilado. He's going to present you with a special token of appreciation. Thank you so much for bearing with us and, of course, enjoying this particular panel discussion. See you on the sidelines of this beautiful Congress. Susan, yes. Back to you.
Thank you so much. As we wind up that, we are going to go into a very interactive session. I'm sure you've seen shows about makeovers. You know, someone comes in looking haggard. They have a bit of an issue with how they're dressing and then how they're speaking. So we have a strategist here by the name David Moba. And this social media that we're very averse to is going to show us how to navigate and work our way there so that then it's no longer something that we fear, but it's something so that then we can become very social media savvy. David Muba, we have a short break. It's about 10 minutes and we'll be done. We move on then to the vote of thanks and ways forward.
Good after lunchtime. This is the hardest session I've ever had because it's past your eating time, but don't worry, it will take a very short time. 1 minute per slide, 10 slides, 10 minutes. So my name is David Muba. I am the head of digital strategy, commercializations and partnerships at Radio Africa. And I am here to take you through a very quick session on, personal branding as scientists. I am not one, but I know a bit about, that space. How do you brand yourself? How can you become a personal brand in a digital world? So I'll talk about the digital media landscape as we speak. And sorry, let me just remove this. I will not go through the platforms. You all know them. We've been told that there's a church elder who was seen on Facebook. So I am sure all of you here truly understand how impactful these social media platforms are. A bit of statistics here. Currently in Kenya, we have around 27.4 million internet users. That's a huge, huge, huge number. But the most important statistic here for me, you see that Eiffel Tower that Lawton was talking about. The daily time spent on social media in Kenya averages 4 hours, 19 minutes. That is not a joke. Spending all that time in a space where you're alone in a room, but you're, feeding information from all over. Another important statistic here is, what do Kenya spend their time on the internet doing? Forget about the rest. I want you to focus on search as of now. But, we need science to be part of this, because we have a lot of people who have this interest, and I'll show you how. So I'll take you through just 7 elements that may define your personal brand digitally. That's the most scientific word I can get, element. So the understanding that I want you guys to get is, 1, understanding the Kenyan search culture. You've seen search is the top. Kenyans are very curious people, and everything you do, they search. You've gone for an interview, you searched. You're looking, you've met someone in a networking session like this, they give you your business card, they search your name immediately after. The URL to Facebook, it's facebook.com or tiktok.com, but you go to Google, you search Facebook, you get Facebook from Google. It's a searching culture, and that's how people find information. Recently, as you've seen, TikTok joined, for the people who have seen, Google and YouTube as the top search engine. Why? Because the younger generation right now are also as curious, but what platform do they love? TikTok. So they have turned it into a search engine. So how do you find your information there? So don't worry, I'll not go through every single bit of this. This document will be sent to you after this, so you'll have a lot more information on this. So you are Googled first before someone reaches out to you. So what are you doing about your brand there? And that's how now you ensure you have a small personal website, proper bios on your social media platforms, and basic search engine optimization, which surely we can help you. Another thing to note is that everything that you put online is permanent. Deleting, view once, don't really work. People have ways of capturing that content, whether by mistake or in whatever way, that content is there. Recently, as you saw, and this was a big story, the one I've put up there, US says foreigners' visas revoked over Charlie Kirk social media comments. So guys are not getting visas because of this. Because it's very simple. Go search this particular person, know their profile, what do they talk about most, and people make decisions about you by the things that you write. So what do? Make sure you are comfortable
if this thing appears between 5 to the next 10 years, whatever you put online, and I don't think science is a very bad thing to be doing. Of course, if you haven't yet, clean up your past online now before no one knows a lot about you. Because one day when you become someone of interest, you never know what guys will find. Point number 3, I decided to chokoza my director here, Dr. Aya. Use quality photography for every season of your growth. And when I say every season of your growth is that you're not the same person you were 5 years ago, 3 years ago. The same way your girlfriend, and you treat her the same way for the next 10 years, she's not the same person, or boyfriend, you know. So same as your profile. Dr. Aya, you did a good job on your profile. I was trying to see if I can upgrade you, but the only thing we can upgrade is here. You can see the consistency. Very professional here, very nice. You can tell he's the same person. And here he looks like a politician. Probably he was one. But you know, that's something now that we can be able to do consistently. We've done a few things, so you can check out Dr. Aya's profile probably later today, and you'll see the transformation. This is how it looks at the moment. So the reason why this should be updated, you don't want to have a profile where you put your photo 5 years ago, and then now you're all gray, and you're going to meet someone and they're like, ni wewe? You know, so represent yourself exactly how you'd like to, like people will not be surprised with who you are. Align your career with what you do. And I've used a very simple example of someone probably we all know, if we don't have Gen Alphas here. Bob Collymore. You couldn't differentiate Bob and Safaricom. He truly represented the brand. And as I show in this example, this is a complaint, customer care as usual, but it's him who was, sorry about it. It shouldn't be your experience. Please give us a chance to fix it. You won't regret it. Can you DM your details to Safaricom Care? And it reached a point where people online used to complain and just CC Bob Collymore, because they know it will be done faster, or maybe that's the notion people had. But even you as a scientist, you can't have conflicting profiles on your pages, Decide this is who you are and this is what you want to represent. And represent it proudly. Align yourself with the organization you are with at that particular point. And I'm sure you'll see the returns. Another one is be authentic. Someone here today mentioned that the information you have is on the 3rd floor. You need to take it down to the 1st floor with authenticity. Crazy. I used an example here of a brand called Ask Kirubi, which was not the name, but the brand of Chris Kirubi online. And this individual had youth write a book about the content that he puts on social media. So there's a book that is very big on Amazon, written by that guy called Bernard Makar, about all the tweets and all the information that he was posting on social media, basically picking and putting it up there. So quality content sometimes gets their own footing and, get legs and drive conversations further than you can be able to imagine. Another thing is to evolve with platforms. You cannot, these things evolve, and this is one of my favorite slides because I normally tell people the format is the same. It's text, image, video, and audio. So the way it's represented is what changes. For example, audio on radio is the same audio that is now used as podcast, right? So the format is the same. Format is the same. But are you evolving with the formats? In terms of video, We have Instagram video, we have TV, we have YouTube. This is the latest format for Instagram. I don't know if any of you know this. I think it's 1520 by something. This, I am not sure what the inspiration was, but you'll start seeing this often. And WHO recently, how long ago was this? September, I guess, said Instagram's formats may keep changing, but our mission remains the same since 1948. They've already jumped on that, and they are running with it. So formats will change, move with the time. Don't be too 2015. Another pointer, almost at the end, tell your story before others do. Why? You're creating your narrative. For example, what area of science are you passionate about? Is it youth? Prof here mentioned about inspiring the youth and taking charge of the youth. So communicate that. Let people know you for your passion of science, yes, but also with the youth. Tell the story. Tell the story as you. Immediately you do that, search first. So the reason why I've put this example here is because Google is like a basket and you have apples and oranges. So you decide what narrative. If you decide if the apples, which are stories about other things about you, are more than the oranges, people will know the apples about you. But you have the capability of controlling how many oranges you want on this platform. It's a basket, and people just randomly put their hand in. The more the apples, they'll pick that from you, and the more the oranges, that is what they'll pick. So try as much as possible to tell your story the way you want it to be. After you've done that, I'll show you something that we can support you doing being an early adopter in everything, like the way I've just shown you the new format for Instagram. Try it out with some random content. But someone earlier mentioned that they can't stand TikTok. But I can tell you for sure, TikTok is the only platform as of now that supports science. You know, if you go to your TikTok app at the moment, and if you can, please go onto it, you'll see the first tab is STEM. Science, technology, engineering, and maths. You can check it out on your TikTok right now. There's no other platform, social media platform, that puts science first. This is the only platform. If you go on that platform, you'll find content from every other country other than Kenya. Remember, it picks Kenya first. This is a huge opportunity for all the scientists that we have here. Huge, huge opportunity. But what do you get? The twerking that she was talking about and everything else, because TikTok is driven by algorithm. So what you give it is what it gives you, and learns that this is the type of content that you want. As you scroll through that area, the STEM, you'll see a lot of interactions. So the interest is there, but the content is not there. So those lab tests, those research that you do, package them properly, and trust me, in 30-second reels, you'll definitely make a huge impact. I mentioned about telling your story first, but we have Mr. Ilado in the room, and he's the editorial director for The Star, which is read by smart people. So once you tell your story, and Ilado, congratulations on this. The Star was able to distribute, we can work together on this. Finally, in the past, you had your CV, your paper, but right now, whatever we've talked about, And that online profile is the representation of your CV in 2025. So start now. If you haven't, start today. Choose the platforms that you think work for you, or the ones you're happy working on. If your passion is on LinkedIn, go on LinkedIn. If you feel Instagram is a place, please do it. Align your brand with your values, like we've seen Bob Collymore earlier. Engage consistently, talk to people, respond to comments, and everything else will work out. I said I'll send this presentation to all of you, and it has a lot more, which was prepared also by Susan here, on how to show up in legacy media. And that means when you go to interviews, when you go to TV, how do you behave? It will be in this document. Thank you very much.
Thank you, David. We are at the end of the fantastic, the STAR Aphrc National Science Research Translation Congress. Please give yourselves a round of applause. Now, the next two speakers who will wrap it up for us in a wonderful bow is Professor Violet Nanyu, who will be able to share next steps, and then we'll have a vote of thanks by the editorial director, Mr. Poliato.
Thank you. Thank you. Thank you very much. What a day. Personally, I have met new people. I have learned how lousy my brand is and the need for someone to style me up. But more so, I've realized how important it is to continue this conversation about translating our research. And they had a slide where they were showing on average it takes about 17 years for good evidence to actually end up being used. So which echoes what our panelists have been talking about. As I wrap up, I also want to give my vote of thanks. Thank you for the honor of chairing and supporting this particular event, distinguished guests, journalists, scientists, my fellow teachers and researchers, ladies and gentlemen, it's time for lunch. I want to thank the Radio Africa group, more so the Star Health team in particular. I want to thank the APHRC fraternity for hosting us on their beautiful campus. Thank you, Uluwazi, for the yummy drinks and snacks. A clear basis for my hypothesis that lunch will be awesome. Thank you, Lotan Salape. You're so funny. I enjoyed every minute. I don't know that he's still in the room. Thank you very much, our very able moderator, Susan Kimashia, for your flawless guidance, even when IT almost dampened our online sessions and we were late with all kinds of things. I liked your smile and the way you carried yourself. You made it really, really easy to follow. And to our sponsor of this inaugural National Science Research Translation Congress, we say asante sana. The money was very well spent, as you can see. Please continue supporting us as we plan our first National Annual Science Translation Congress in 2026. So basically, that's where we are heading. And as the DG said, we would like to invite more people. There will be abstracts, there will be presentations. Of course, we'll pick a theme for every year. We're expecting more technical people from the Ministry of Health to be present, to be in the audience. He kept saying they need to be in the audience to hear what the journalists and the scientists are saying. So we look forward to inviting you again and your colleagues, and we hope you'll show up. We will need you to be some of our keynote speakers. We will need you to present your own science and your experiences from the field. Tuungane pamoja, and let's keep this going for the sake of Wanjiko. Thank you so much for coming. Over.
All right, thank you. It was an absolute pleasure to host you today. We are now headed for lunch. I've been told the instructions are you go up the stairs. There's a lady there who will be smiling. She's bespectacled. She has a dash of yellow, and the rest is black, and she'll issue a lunch voucher, and then you'll proceed to be able to enjoy APHRC's hospitality. Thank you indeed. My name is Susan Kimashia. Have a wonderful afternoon.